Hello, I'm Miguel. I'll be your nurse today. I'm going to be giving you a head, ears, eyes, nose, and neck exam. Okay. All right. So first, I'm going to start with inspection of the head. Okay. I'm going to be inspecting while palpating the head. Okay. Tell me if anything hurts.
No.
Good. Okay. All right. Head appears normal, normocephalic. No protrusions or sunken in areas. No palpable swelling or lesions or lumps noted. No masses present on the head or the scalp, which is good. Okay. I'm also going to be palpating the temporal artery. No enlargement of the temporal artery, which is good. No tenderness of the temporal mandibular joint, which is normal. Okay. All right. What else I gotta open and close? Oh yeah, and then okay, I'm going to have you open and close your mouth. Good. Okay, and then I'm going to have you. I'm going to be touching a part of your face. Tell me where I'm touching.
Right forehead?
Okay, very good. So sensation of the patient's face is normal. Patient can identify and localize where sensation occurs, which is, and patient is able to move his jaw with full range of motion, no tenderness to the jaw noted, indicating that the full range of motion as well as the facial sensation indicate functional cranial nerve 5. Okay, all right. Okay, I'm also going to be inspecting the face, the skin of the face, as well as the movements of the face. Okay, so the face looks normal. There's no lesions, no edema, no swelling noted, no lumps noted in the face. Okay, just palpating sinuses of the face. Sinuses of the face look or feel normal. No tenderness in any part of the face. Okay, I'm gonna have you do a few little movements with your face. Okay, just check, make sure if your cranial nerves are good. So, can I have you smile? Very good. Can I have you frown? Very good. Puff your cheeks. Good. And then raise your eyebrows. Good. Okay. So movements of the face are normal. Movements of the face are normal. No involuntary movements. Full control of the face. No tics or uncontrolled involuntary movements are noted in the face, indicating intact cranial 7 nerve function. Okay, so now I'm going to be inspecting the eyes of the patient. So, okay, can I have you look forward? Okay. All right, so right now I'm testing the dilation of the pupils as well as looking at the surface of the eye. I don't notice any irregularities, masses, or surface abnormalities with the eye. The eye looks clear and normal. Okay. All right. I'm going to be looking at the conjunctiva of the eye. Okay, good. I don't have a scope for this, so I'm just using my phone. Okay, good. All right. Very good. All right, conjunctiva of the eye look good, nice and pink, pinkish red. No masses, no bleeding or discharge in the eye noted, which is normal. dilation of the eyes look, or reactivity of the eyes look good. Very good. Reactivity of the eyes look good. So there is both direct constriction as well as consensual constriction. So initial illumination of the pupil indicates direct constriction, which is a normal response to light, where the illuminated eye constricts, and then consensual constriction is also noted, where the other eye also becomes constricted in response to the illumination of the opposite eye. The eyes are perla, indicating that the pupils are equal reactive to light. Now I'm going to be checking the accommodation of the eye. So I'm going to have the patient look at my finger and then look at me. Good. Look at my finger and then look at me. Good. So by testing the accommodation of the eye, I'm looking to see that the pupils dilate and constrict in order to focus on near and far objects, which is normal for the patient's eyes. Okay. So the patient's eyes show clear accommodation. I would have also conducted a Snell's test. I don't have a Snell's chart where I would be testing the patient's near and far vision. Near and far vision and ability to discern objects at particular ranges. Okay. All right. And then I'm going to be testing the peripheral vision of the eye. Okay. Tell me when you can see my fingers. Good.
Bottom one, not the top one yet.
Good.
See your hand. There we go.
Good. Okay.
Bottom left. I'm still not seeing the upper. There we go.
Okay.
Upper right.
All right. Peripheral vision of the eyes looks good. It's equal on both sides. Patient can see my hand without directly moving his face or his head or eyes, which is normal. Oh, and then I'm also going to be checking the extraocular movements of the eye. So I'm going to be checking the ability of the eye to track objects as well as their movements. So I'm going to be having you trace my finger in the cardinal direction, so left and right. Good. And then up and down. Okay. And then near to far, far to near. Okay, good. Tracking of the eyes is good. Eyes move consensually and is able to track objects adequately in all cardinal directions, which is a normal finding of the eye. So now I'm going to be, if I had my scope, I would be looking at the intraocular structures. So I'd have the patient look. I'd have the patient look towards a distant object, at the clock at the wall, for instance, and then I would be approaching the patient at about a 15-degree angle, okay, with my scope, and then using my fingers to guard. Okay, I would be inspecting the internal structures of the eye. I don't have the scope, obviously, so I'm just going to be pretending. I'd be using my right eye to look into the right eye of the patient, and then concordantly with the left, and using my fingers to guard, so I wouldn't come in contact with the patient's pupil. So inspecting the internal eye should note that no abnormal vasculature or no degeneration or floaters within the eye. No changes to the retina. Just looking at the internal structures of the eye to make sure there's nothing abnormal with the retina or the blood vessels within the eye. Okay. Now I'm going to be inspecting the patient's ears. Okay, so for the ear inspection, I'm just going to be looking at the ear first. Okay. I'm looking for any discharge in the ear. Okay. obviously I would have my scope in real life, but just to pretend, I would retract the adult patient's ear up into the posterior direction to have a clear view of the tympanic membrane of the ear canal. Okay, the tympanic membrane looks good. It's off-white, no inflammation noted, no discharge noted. Okay, I'm going to be gently palpating and tugging on the pinnae of the ear. Okay, no pain noted. Do you have any pain, sir? Good. No redness, discharge, swelling of the ear, or pain. Okay. And then I'm going to, if I had a tuning fork, I would be conducting conduction tests. So I would be conducting tests for air conduction as well as bone conduction. So normally, sound conduction is more audible through air as opposed to bone. So, so placing the tuning fork here should be audible to both ears, as opposed to placing the tuning fork directly in the bone, which is a normal finding. Okay. And then also I will be doing a whisper test to assess the patient's hearing. I'm going to be saying a common 2-syllable word to have the patient recite to me what he heard to assess the patient's hearing. Apple. Good. Apple. Okay, good. So patient's hearing is intact. Ears are normal on both sides. Okay, so now I'd be assessing the patient's nose. All right. Okay. So with the patient's head looking up, using my scope with the light on to look at the internal structures of the nose. Okay, I'm looking at the walls of the nose. The nose is normally very vascular, so I was comparing both sides to see if they were symmetric. There's no swelling present in one that's not in the other, as well as looking at the septum of the nose, checking for any deviation of the septum, or as well as looking for any bleeding or lesions noted within the nares. Okay, nares look good. Okay, so now I'm going to be using my gloves to be assessing the mouth of the patient. Okay. They're not good size. Okay. All right, so now I'm going to be assessing the oral cavity of the patient. So I'm going to have the patient look up. I'm going to be putting my light on just to see it a little bit better. Can you open your mouth? Very good. All right. So right now I'm just palpating the buccal mucosa of the mouth, as well as, can I have you lift your tongue? Okay. All right. I'm inspecting all areas of the mouth, looking at the palates. Okay. I also looked at the sides of the mouth, the mucosa, as well as sublingually to look at the salivary glands. I'm looking for any redness, as well as palpating for any lumps, looking for any redness, swelling, or lesions in the mouth. Do you have any pain in your mouth? Okay, good. Also looking at the gums of the mouth, looking for any inflammation within the oral cavity. I would also be using a depression stick to look at the tongue, the back of the tongue, as well as the tonsils. The patient notes that he doesn't have any tonsils due to a tonsillectomy.
That was 2.
Yes. There's no discharge or productivity in the back of the throat, which is good. No inflammation there either. Uvula looks good. Okay. Okay. So that concludes the oral assessment. I'm going to continue with the neck assessment. So, but first I want to see the patient's lymph nodes and sinuses. Okay. Is there any pain? No. Okay. All right. No pain in the patient's sinuses. The preauricular lymph nodes look good. No redness, swelling, or edema in the face or the lymph nodes. No tenderness noted. Okay. All right. And now I'm going to look at the submandibular area. Okay. Checking for the anterior cervical lymph nodes as well as the posterior cervical lymph nodes. Okay. I don't notice any pain, redness, or swelling. Okay. Now I'm going to be checking the supraclavicular lymph nodes. All right. No pain noted in the no pain, redness, or swelling in the supraclavicular lymph nodes. All right. Can I have you extend your neck up? All right. I'm checking at the base of the esophagus for any enlargement of the thyroid gland. Okay. All right. Normally the thyroid gland is not palpable, so there's no enlargement of his thyroid gland, which is a normal finding. And now I'm checking for the throat. Okay. Okay, patient's throat is good. No swelling or tenderness in the throat is noted. The trachea is midline with no deviations or deformities. And that concludes my head, ears, eyes, nose, and throat exam.